Hi, today we will learn about ear irrigation. Ear irrigation is the washing of external auditory canal with the help of a stream of liquid. The purpose of ear irrigation is to remove any foreign object, to remove ear wax and to evaluate the vestibular function. Before the procedure, we have to explain the procedure to the patient, collect all the articles near patient's bedside and check for physician's order. A tray containing Macintosh with towel, clean gloves, gallipot containing dry cotton swabs, NS or irrigating solution, syringe without needle, torch, kidney tray and a paper bag. First, we will wash our hands and put on a clean glove. Then we will place Macintosh and towel to secure the patient. Then we will tilt the patient's head and visualize the affected ear with the help of a torch. Then we will take a cotton swab or cotton tipped applicator dipped in the irrigating solution to clean the external auditory canal. Now we will fill the syringe with the irrigating solution and pull the pinna downwards and irrigate the ear until the ear is clean. Now we will dry out the excess water with a dry cotton swab. Once the irrigation is complete, we will tell the patient to lie on the side of the affected ear. After the procedure, we have to replace all the articles and discard the waste, and we have to report any significant findings and the appearance of the drainage.